Each year, countless children and adolescents experience concussions, yet the full extent of their impact and necessary steps for recovery remain overlooked. Joining us during Brain Injury Awareness Month is Stacy Gray, MUSC Pediatric Concussion Program Clinical Director, and Kiki Thayer, Speech-Language Pathologist and Certified Brain Injury Specialist with MUSC. Ladies, thank you for joining us today.
Thank you for having us.
And now, concussions, it's something that's kind of a commonality. I mean, I feel like most everyone, I know I've experienced a few concussions in my younger years, but what is a concussion?
So a concussion is an acceleration and deceleration injury to the brain that can be caused by a direct or indirect blow to the head, the neck, the body, and can temporarily affect the function of the brain and can cause resulting symptoms that have varying duration of time.
Now, what is the most common cause of a concussion?
Oh gosh, falls, motor vehicle accidents, it can be sports injuries, all different types of injuries. We see a multitude of causes.
And are they more common? Do you see them more in children?
Well, we are a pediatric concussion clinic, and so we definitely do cover that basis, but they can happen throughout the lifespan.
Absolutely. And now, how do the symptoms differ, or what are the most presenting symptoms that you see when a child comes in with a concussion?
So there are 4 basic areas that symptoms fall into. They can have physical symptoms such as headaches, dizziness, balance problems, difficulties with their eyes. They can also have cognitive problems, difficulties paying attention, problems with memory or understanding information. It can also impact sleep, and it can impact your cognitive and thinking abilities.
And now, can you speak to the importance of early detection?
So they found that the earlier you address it, actually the better they'll do with their healing, because it affects their lives. It affects their return to school, their return to work, their return to sports. And so sometimes if those symptoms aren't managed, those symptoms then prolong. And so we want to address that earlier and get better results quicker.
What are some of those long-term implications that can come from a concussion that goes untreated?
So, like I mentioned, it can cause difficulties at school, which Kiki can speak more to, but they can struggle with sports. They can be continuing to have headaches. They can have balance issues, dizziness, and it could just affect their function of being a kid in life. And so,
And now, can you speak to the school aspect of it?
Sure. Often after a concussion, if they're having any of these symptoms, they end up having missed days. Their grades may drop. They have difficulties completing the work in school. And so the focus is really getting them back to school as soon as we can, but maybe with accommodations or things that we can do to make sure that they're learning, that they're maintaining their good grades, and that they continue to improve as quickly as they can.
And can you speak a little bit more to navigating the return to school and the return to play?
Sure.
you can go ahead with school.
Sure, with return to learn is what we call it. We often, the newest research shows that we try to get them back to school within 3 days. But it may be with accommodations, they may go half days, it may be that they're not using screens, it may be we limit the amount of work they're doing or the amount of tests they have in one day, and really working up. So it's also the social component is very important. The longer they're out of school, the more likely they are to get further behind, but also to have increased anxiety, even possibly depression, because they're missing the social components as well.
And that also plays in the return to play, I'm sure.
Definitely. And so even if you're not an athlete, getting back to activity is very important. So after about 24 hours to 48 hours, we actually want them to start to do some light activity, like going on a light walk. I call that the walk the dog phase, just a nice leisurely walk and seeing how they tolerate it. And then we progress them gradually through that return to exercise at a tolerable level. And because same as with what Kiki mentioned, there's that social benefit if they are part of a team. There's the benefit of endorphins from exercise, avoiding deconditioning, and just that increased blood flow to the brain to help with healing.
And now as far as treatment go, I mean, is there like a medication you prescribe, or is it really just, I mean, what you ladies were just speaking about?
So we don't actually, that's not usually our first resort, I would say, is medication. Usually, sometimes there are like vitamin supplements we'll recommend to start with, but a lot of times they'll have what's called an ocular motor dysfunction, like how their eyes are moving, and or a vestibular change in how they're sensing where their body is in space. And so we'll assess those systems and then address the symptoms and give them exercises. We'll address balance, and so a lot of times that will help with their symptoms, as well as management of their sleep, their hydration, their diet sometimes. A lot of these things help with addressing the symptoms they're having.
Wonderful. And now, are there there any events or clinics where our viewers can go to learn more?
Well, so at MUSC we have a pediatric concussion clinic. It's every Tuesday and Thursday, and we're actually increasing that to every Monday, Tuesday, and Thursday because of the need in the community.
So this conversation is even more important.
Absolutely, especially this month.
Yeah,
bringing awareness to these injuries.
Absolutely, and you can visit musckids.org for more information as well. Ladies, I want to thank you for joining us today.
Thanks for having us.
We're back.
Thank you.
After this.